Health Minister Ruth Aceng has lambasted local politicians for denying the health personnel the opportunity to broaden their knowledge on the pandemic. The criticism followed recent reports that local politicians and some members of the public from Gulu had blocked a vehicle carrying a truck driver who tested positive for the COVID-19. The driver, who was en route from Malaba border to South Sudan, was to be isolated at Gulu Regional Referral Hospital on the instructions of the Ministry of Health.
Gulu Regional Referral Hospital and Acholi work with the university. Coronavirus is a new virus. All countries that have coronavirus are doing research. So why deny our scientists a great opportunity to do research? So one of the reasons why we want patients, when we get them, to be treated in all the regional referrals is to give our scientists opportunity to do research and tell us about COVID in Africans. We are only learning about COVID either in Europeans or in Asians or in Americans. What does it do to Africans?
The health minister notes that strengthening the capacity of the entire health system in the country remains a top priority to the ministry.
Our work here is to ensure that we have decentralized as much as possible and you have built capacity so that whichever direction the pandemic takes us, we are ready. And that is why we are sending teams down to train, to assess, to see what we can quickly plug in, even with our meager resources.
Currently, the ministry has set up a number of isolation and quarantine centers across the country, although many continue to face logistical challenges. Aceng notes that some of the challenges will be addressed soon.
By mid next month, we shall have PPEs locally produced in the country. We already have samples, very nice samples that the scientists are looking at, making sure that they are the right specifications and so on. Government has already purchased equipment to manufacture masks in country. We have been having challenges placing orders for masks. You place an order and a small quantity is sent to you.
Aceng advised the locals to maintain precautionary measures even as cases of COVID-19 continue to drop almost 2 months since they went into lockdown.
So as the country begins to prepare to begin a first lifting of the lockdown, of course it can't be lifted all at once. There is a lot of assessment going on. It will be a first lifting. We all have to prepare. Of course, we are looking at the ministries, departments and agencies with high economic impact and low risk, lifting up first. And those with very low economic impact but highest risk of COVID opening last.
Nelson Omoya, NTV.